It was 2 years ago I got my first coronary calcium screening at Sullivan County Community Hospital. My parental grandmother died from coronary disease.
Anybody with high blood pressure, high cholesterol, diabetes, smoking, family history of heart disease, anything like that would always be a good test to get.
Getting the scan is really easy.
No eating or drinking 4 hours prior, especially no smoking and no caffeine. That is just so we can get the heart rate as level as possible. If you have to take your medicine with a little bit of water, that's okay. I'll take the scan that we did on our CAT scan machine and I will send it over to a separate workstation. And from there, I will go slice by slice and see if there's any calcium buildup that pops up. It'll pop up green on my machine. And if it's in the vessels that we score, then I will circle it, and then from there it'll calculate a score. The scan itself usually takes about 15 minutes. And then from that, the scoring of it takes about 10 to 15 minutes, so you're really only here about 30 minutes.
And the cost is minimal, paid at the time of the scan.
For only $50, you're going to get a quick CAT scan that could show any calcium buildup, and it could possibly save your life.
Kurt Hauger, a pharmacist at the hospital, decided to have the heart scan.
I have a family history of cardiac issues, with my mother having open heart surgery, and my dad had a mild heart attack. So they offered the cardiac scoring, and I thought, well, why not? Let's get this done.
At the time, he was a coach.
Coach high school soccer, running with the girls, practicing, no issues whatsoever. No chest pain, no shortness of breath. I thought I was fairly healthy.
But the heart scan revealed a different story. You want to be as close to 0 as possible. 1 to 10 means mild, 11 to 100 moderate, 100 to 400 some buildup, and above 400 not good.
My score was 212, so I didn't think it was significantly high, but I showed it to my personal physician and he said, based on your cardiac history, let's just go ahead and set you up with a cardiac cath. Lo and behold, I had a 95% block in my left anterior descending artery, which is called the widowmaker. And I had no idea that I had any issues at all.
Stories like Kurt's are why Ashley is glad she can work with the hospital to offer this service.
You do feel like you're making a difference in people's lives. You know, when you get somebody that's had a high score and they've had no chest complaints whatsoever, and they go and get treatment that they need, that could be life-saving.